Another day, another story. Obesity. Obesity is a medical condition in which an individual has an excessive amount of body fat, to the point where it can negatively impact their health. It is typically diagnosed using the body mass index, BMI, which is a measure of body fat based on a person's weight and height. In general, a BMI of 30 or higher is considered to indicate obesity. However, BMI is not always an accurate indicator of obesity, especially in athletes and people with a lot of muscle mass. Obesity is a complex condition that can be caused by a combination of genetic, environmental, and behavioral factors. It is associated with a range of health problems, including diabetes, heart disease, high blood pressure, and certain types of cancer. Treatment for obesity usually involves a combination of lifestyle changes, such as regular exercise and a healthy diet, as well as medical interventions, such as weight loss, medications, and bariatric surgery. Causes of obesity. Obesity is a complex condition that can be caused by a combination of genetic, environmental, and behavioral factors. Here are some of the main causes of obesity. Genetics. Some people are more predisposed to obesity due to their genetic makeup. Certain genes can affect the way the body stores and processes fat, as well as the feeling of fullness after eating. Environment. The environment in which people live can also play a role in the development of obesity. This includes factors such as access to healthy food, sedentary lifestyles, and the prevalence of fast food and processed foods. Behavior. Behaviors such as overeating, consuming large portions, and a lack of physical activity can contribute to obesity. Psychological factors such as stress, depression, and poor sleep can also lead to overeating and weight gain. Medical conditions. Some medical conditions such as hypothyroidism, Cushing's syndrome, and polycystic ovary syndrome can cause weight gain and lead to obesity. Medications. Certain medications such as antidepressants, antipsychotics, and corticosteroids can cause weight gain and contribute to obesity. Socioeconomic status. People with lower socioeconomic status may have limited access to healthy foods and safe places to exercise, making them more susceptible to obesity. It's important to note that obesity is a complex condition, and in many cases, it may be caused by a combination of these factors. Health risk of obesity. Obesity is associated with a range of health risks, including type 2 diabetes. Obesity is a major risk factor for type 2 diabetes. Excess body fat can cause insulin resistance, which can lead to high blood sugar levels and eventually, diabetes. Cardiovascular disease. Obesity increases the risk of heart disease and stroke by causing high blood pressure, high cholesterol, and other factors that can damage the heart and blood vessels. Respiratory problems. Obesity can cause respiratory problems such as sleep apnea and asthma, which can lead to shortness of breath, fatigue, and other complications. Joint problems. Excess weight puts a lot of stress on the joints, which can lead to joint pain, osteoarthritis, and other joint problems. Certain cancers. Obesity is a risk factor for several types of cancer, including breast, colon, kidney, and pancreatic cancer. Mental health problems. Obesity is associated with an increased risk of depression, anxiety, and other mental health problems. Digestive disorders. Obesity can increase the risk of digestive disorders such as gastroesophageal reflux disease, GERD, fatty liver disease, and gallstones. Reduced life expectancy. Obesity is associated with a reduced life expectancy, as it increases the risk of premature death from cardiovascular disease, cancer, and other health problems. It's important to note that obesity is a complex condition, and the health risks associated with it can vary depending on factors such as age, gender, and overall health status. Thanks for watching.